Hello, I'm Philip Home, and this brief video recording is going to deal with the topic of severe COVID-19, metabesity, and vascular inflammation. The same vascular inflammation that causes all those problems with aging and diabetes. If I mention any therapies, I'm likely to have some duality of interest. I have just 3 slides with quite a lot of builds on them on this topic. Firstly, severe COVID-19, I would suggest, is a disease of vascular inflammation, not of infection. Notable clinical features have been increased vascular permeability, manifested and recognized early on as respiratory distress syndrome, lung scarring, of course, a feature of inflammation, scarring, high thrombotic tendency, something that arises from endothelial damage, and cardiac damage and failure similarly. These strongly suggest that there's some damage occurring to the endothelium in diverse organs. I suggest vascular inflammation. Notable associations, clinical associations with COVID-19 are given here. And of course, early on were recognized as diabetes, male sex, and old age. And later, when the disease moved more out of China, ASIC and Asian and Black ethnic groups also were recognized as being at risk. And then also, again, outside China, obesity, with perhaps more equivocably high blood pressure. Now we know these groups. This grouping is known for its high risk of chronic vascular disease, notably in old age, and it's known generally to be associated with the metabolic syndrome. So I suggest that this suggests that severe COVID-19 occurs in those already suffering low-grade vascular inflammation, similar to that gives rise to arterial disease and diabetes complications over many years in the same groups of people. So where does vascular inflammation come from? Obesity, of course, is a known pre-inflammatory state. Many cytokines are elevated. The source of many of those cytokines is, of course, the liver, notably in association with fatty liver and raised CRP. Hyperglycemia, glucose toxicity, also gives rise to a diverse spectrum of vascular damage, and lipotoxicity, similarly due to high levels of fatty acids, results in dysfunction of many tissues. So it is these things together which are giving us the vascular inflammation. Now, I'm not suggesting that obesity or fatty liver per se are the causes of the pro-inflammatory state, but rather of the metabolic processes within them that do this, and particularly related to some fatty acids, diacylglycerol, and things of that kind. These associations are usually driven by excess substrate load, which of course gives rise classically to obesity, being excess calorie intake or excess exposure to metabolic substrates, damaging metabolic substrates like glucose and fatty acids in our circulation. Other mechanisms are important, of course. For example, hyperglycemia decreases the production of endothelial progenitor cells from the marrow and thus inhibits vascular repair. So if we put all this together then, of course, what we note first of all on the right here is that a whole series of different impacts on health, which occur generally in association with aging, also are increased in people with diabetes. Diabetes, of course, is a particular exposure to an excess substrate, namely the poison glucose. Obesity gives us exposure as an association to all those things that we actually eat. So this probably reflects the double insult of excess substrate, calorie intake, and direct tissue exposure to glucose and fatty acids. The common underlying risk here from both aging and diabetes may be vascular inflammation. But of course, with specific end pathways in different tissues, and thanks to chaos theory and genetics occurring with a different propensity in different people. Normally, of course, the process is a slow one. It will be difficult to show modulation with medications without accepting surrogate outcomes if we think of diabetes, a long history of that problem, and aging. But with COVID-19, we're in a different situation because we have an acute disease, severe COVID-19 associated with vascular inflammation. Unfortunately, fortunately, vascular inflammation can be reversed quite quickly. If you put people on low-calorie diets, ALT falls within 1 week, as of course does glucose. So acute lifestyle change is thus worthwhile to prevent severe COVID-19. But the common underlying insult, and the one which we really must deal with, both with COVID-19 prevention and indeed prevention of the diseases of diabetes and aging, is excess calorie intake. I thank you for your attention.